ambulance is going code 3, lights and sirens. The men and women of EMS, Emergency Medical Services, are transporting our critically sick and injured. It is one of the most important jobs in the world and one of the most dangerous.
Big bump! We've had an ambulance hit and flipped, and we've had people in wrecks.
And potholes and traffic aren't the only dangers.
Diseases are a very big concern. Age.
Every call is dangerous. You can be going to a simple sick person, walk in the house and take a bullet to the chest.
Ambulance drivers are now highly trained medical professionals, but they know they can only save your life if they safeguard their own. To get to the scene, they must arrive alive. Mississippi River empties into the Gulf of Mexico. Here, the principal ambulance service is run by the city's health department. Like emergency medical services across the country, it has come a long way from a rocky beginning.
When I first came to NOHD, there were the old orange and white van units, and a lot of times they'd break down, and we had like 4. Well, in the old days, we'd do a thing we call snatch and run. We'd pick up Joe Blow, throw him in the back of the ambulance, and rush to the hospital. Well, unfortunately, you know, by the time you rush to the hospital, just throw him, he'd bleed to death. 9:45. Then training came along. We learned how to stabilize this person before we moved him, how to start the IVs and do what needed to be done immediately, and then we can go to the hospital with him. I can remember once when our response time was somewhere in the neighborhood of 20, 30 minutes. Our response time now is down somewhere, I guess, between 6 and 8 minutes, which is really good.
A lot has changed, but many of the dangers remain.
8, we're at Tulane and Galvez. You want us to take it?
Gretchen Helms knows the streets of New Orleans well. She's worked them as a paramedic for 9 years. They present just one of many hazards of her job.
I've been in a couple fender benders. I've been in the back before where we totaled an ambulance and my face got mushed.
Paramedics face a host of dangers, including accidents, violence, and disease. But surprisingly, there have been few statistical studies about those dangers. Fortunately, that is changing.
The dangers are just now becoming known. There's been a couple of published research articles and some current research that's being conducted that indicates that the fatality rate among emergency medical services providers is comparable to the fatality rate among police and firefighters. And that's much more dangerous than anyone has ever thought of before.
In fact, the best guess at this time is that EMS workers are 8 times more likely to be injured than the general population. While on the road, an ambulance, and everyone in it, is twice as likely to be in a serious traffic accident. Today, Gretchen and her partner Chris Gennard are on their way to a call.
Stop.
As usual, New Orleans traffic isn't to Gretchen's liking, and neither is the fact that their assignment might be a crank call.
A call came out uptown of somebody possibly shot in the stomach, but they said that it sounded like a bunch of teenagers and they were laughing. But unfortunately, we can't just blow that off, and neither can the police department. So now you're going to have at least 2 police cruisers, a police supervisor, and an ambulance, code 3, to something that's probably going to be unfounded.
Unfounded or not, Gretchen and Chris have to assume that there is a life to be saved, and that means putting themselves at risk. To get to the scene as quickly as possible, Gretchen stays in the left lane, signaling cars with her siren to move right and let her pass.
My big concern is that there is not a federal law concerning ambulances. Each state is different. The law in Louisiana is move to the right and stop. If they move to the right, you're very thankful. Very few of them stop. Very few people move to your right.
And today, one car about to change lanes for her finds its way blocked and suddenly puts on its brakes.
Are y'all okay?
In the back of the ambulance, Chris has taken a fall.
A car must have pulled out in front of my partner or something and completely knocked me on my butt.
In the meantime, Gretchen's instincts about the call turned out to be correct. It was a prank. Dispatch found out just in time. Another call, legitimate this time, comes in.
Right now we're pulling up on a scene of an elderly male who's having a diabetic crisis. They say he's unresponsive, so we're gonna get our stuff and see what's going on.
Chris and Gretchen get their patient to the ambulance. They have to move quickly. He is in a diabetic coma and his condition is critical. Had they been tied up by the prank call, they might not have gotten to him in time. As it is, they're still not sure they have. EMS supervisor Barbara Ireland was in the field at the time of the call and caught up with them to lend a hand.
What we have here is we have a medical call here of an elderly male. The nurse upstairs in his room said that his blood sugar is very low, that it's 15 milligrams per deciliter, which is extremely low.
The normal level is between 80 and 120 milligrams. The patient is in grave danger, and there is no time to take him to the hospital. They'll treat him right there in the ambulance. If Chris and Gretchen are too late, he faces brain damage or death. Barbara pumps the patient full of D50, a 50% solution of dextrose, or sugar. This is the only thing that can save him. And it does, almost immediately.
Hey there. How you feeling? Your blood sugar's low. You know that?
No.
You're looking a lot better. How you feeling now?
Better.
You feel a lot better, don't you? Good.
With their patient stable and out of danger, Chris and Gretchen can now get him to the hospital.
All right, since we can't go to Ochsner, we're en route to Mercy Hospital, code 2.
Because their medical training allowed them to treat their patient in the ambulance, there is no need for them to speed and endanger his life, theirs, or the public.
We don't have to drive as fast to the hospitals. We don't have to take a chance of getting in wrecks and running red lights like you're just flying down the street.
Today, paramedics receive varying degrees of driver training, but there are no national standards. Increasingly, there is a call for a greater awareness of the dangers of high-speed driving.
Please do not get these two things mixed up. High-speed driving and emergency driving are two distinctly different things.
Mike Montecalvo frequently lectures paramedics, EMTs, and first providers about safety in the field.
Driving is a skill that we train with the least. Back then, in the mid-70s when I started my career in 1975, you learned how to drive by just doing it. I mean, you drove hard, you got there quick, and you saved that life.
And Mike himself knows firsthand the consequences of driving hard and getting there quick.
April 26, 1989. I had just finished a 24-hour shift with the fire department I was with and started a 24-hour shift with an ambulance company I was moonlighting with. The 911 phone rang from the neighboring city, requesting an ambulance respond to an automobile accident with injuries, giving this certain intersection, involving 3 children and a baby and bodies lying all over the road. Now, what does that do in here? I jump behind the wheel and off we go.
Mike and his partner have the only available unit, and the scene of the accident is 17 miles away. At the time, in the state of Ohio, there was no limit on how fast an ambulance could go. Minutes after hitting the road, Mike approaches an intersection.
I looked at this light one time. It was green. Bad mistake. If you're looking at a light and it's already green and you didn't see it turn green, it's getting ready to turn red. And just as we had entered the intersection, that light went red for us and green for the right-hand side.
A car, hidden from Mike's view by a truck, enters the intersection. Its driver, a young woman, is unaware that traffic has stopped for an emergency vehicle.
I didn't see her until she was directly in front of us. I had enough time to stiffen up at the wheel, and that was it. I have no recollection of the impact at all. The only thing that I do remember, and to this day, I can see it as vividly as if it was yesterday. And I honestly don't know if it's what I actually witnessed or if it's just what I saw in the nightmares afterwards. Was just the face of the driver looking up and seeing us right there and just see this look of stark terror in her face. My next conscious thought after that was the ambulance being on its side. We were spinning, and the front of this thing was, the cab area of the ambulance was filling up with smoke. We were both able to extricate ourselves out of the ambulance. We were both wearing seat belts, so our injuries were minor.
20-year-old Angela Robinson was not wearing her seatbelt. The force of the collision threw her out of the side window of the car. Angela died of massive head and chest injuries.
I can remember when we were en route to the hospital, I looked at my partner, he looked over at me, and both of us just kind of broke down right then and there and said, we got into this business to save lives, not take them.
And Mike, in a precedent-setting case, found himself facing criminal charges, including involuntary manslaughter and aggravated homicide.
Court dates were set and trial dates were set, and I would get a lot of things from my peers that, oh, don't worry about it. They don't send paramedics to jail for doing their job. Well, guess what?
After a 3-day trial, Mike became the first paramedic in history convicted of involuntary manslaughter while on duty. The judge gave him a sentence of 2 to 10 years. He was released after serving 7 months in prison. His career as a paramedic was over. Mike now works in a hospital as a cardiac monitor technician, and he takes his story to whoever will listen.
The response I get from the lectures is, for the most part, very positive. I'll get comments like, we've never had this group sit this still for this long for anything. It's important for me to get the message out as far as how these guys need to be driving these vehicles. Who else is going to tell the story?
In the 10 years since Mike's conviction, many ambulance companies have rewritten their protocols governing conduct on the road. In much of the country, ambulances may still go over the speed limit, but only by 10 miles per hour. But the dangers of the road are just part of the story. Back in New Orleans, Chris and Gretchen are still on duty, and it's Chris's turn behind the wheel. Their latest call, sadly, is typical of a big city. In a neighborhood notorious for violent crime and drug activity, there's been a triple shooting.
Right now you have to go in with your eyes wide open. You can't leave anything out. You have to think the worst. You have to think people out there are fighting. You have to think of weapons being used. You have to watch your back at all times.
For all they know, Chris and Gretchen could end up being shot themselves. They'll have to be prepared for anything. On their way to the triple shooting, Chris and Gretchen are concerned about what they might be walking into. They know that the perpetrator might still be there.
What potentially can be dangerous is that they don't want us to treat them. They want them dead. That's why they shot them.
There's no telling what we could be walking into. We're definitely not going to go into the scene until the police are there.
Until the police declare the scene safe, the situation could be deadly.
6209.
EMS dispatch keeps Gretchen and Chris up to date.
Dispatch is calling police back, and they're listening to the police radio to make sure that the police are on the scene and that the scene is safe. Code 4.
Finally, Chris and Gretchen get the radio call they've been waiting for.
Okay, right now, NOPD and the fire department are on the scene. We have 3 patients. 3 people are shot at this time.
Copy direct. We'll be there in a moment.
Okay, we're here. 932, 932.
932, 932 on the scene, 6208. Where you want us? You want us to come all the way to you?
The scene is chaotic, with police, another ambulance, and EMTs from the fire department who were there as first responders to lend a hand. For the moment, Chris parks the ambulance several yards away.
All right. All right, we got one person that's coded and one cardiac arrest right now.
While Gretchen stays behind to reposition the ambulance and move it closer, Chris rushes to the scene. For all he knows, the shooting is drug or gang related. Even with police there, the potential for violence is still high.
6208.
Chris identifies himself to the police at the scene.
What we got?
The shooting is not drug related. A family argument got out of hand. A domestic scene is just as dangerous, however, and police have roped off the area.
Where are the other guys at?
One here, and this guy here is superficial.
Okay.
He's going first. He's coded.
Okay.
One man shot in the chest is coded as cardiac arrest. His heart has stopped beating. Another is conscious but in critical condition.
Okay, lay back, relax.
A third man has suffered only superficial wounds and is taken outside to be treated.
All right, we need to take the trauma code.
Gretchen and Chris will be responsible for the most critical patient. His heart is still not beating, and he cannot breathe on his own. He must be taken to a trauma center as soon as possible. But here is where paramedic training comes into play. The patient has a better chance of survival if they first take the time to stabilize him at the scene. And with all the equipment at their disposal, there is no better place to do that than in the back of an ambulance.
I need somebody to come bag him, and we need somebody to ride with us.
CPR, come on up here.
Squeezing the bag valve mask forces oxygen into the lungs, but Chris doesn't like what he hears through his stethoscope.
Gretchen, let's reconfirm breath sounds, please. He's a little shallow on the left. I don't know if the tube's down too far or if he needs to be decompressed.
The patient has reduced breath sounds. Something, either fluid or a pocket of air, is pressing against his lungs.
Okay.
I need some more tape to secure this tube better, and then we're out of here. Look, man. Right there, hard as you can.
They've done what they can do immediately. They must now get to the hospital.
There we go. Let's go. Rock it. Alrighty, here we go.
They are on their way. Firefighter Calvin Thompson stays on board to help with the patient.
You're doing great. Doing a good job.
We have the fire department and first responders. They've really been a big help to us. These guys are kind of new, but they've really been a big help to us, and he's doing compressions back there. Normally, Chris would be back there by himself doing compressions on his own, and trying to bag him, give him medication, and decompress his chest is just not possible. It's very hard.
While the driver of the ambulance is protected by a seatbelt and airbag, this is a dangerous moment for the medical personnel in back. Moving around and treating the patient, Calvin and Chris are at great risk.
Okay.
At the present time, there's no way to restrain the paramedic in the back of the vehicle if they have to be taking care of the patient. If that vehicle is involved in a collision, during the time that the paramedic is unrestrained while they're taking care of the patient, the paramedic becomes a projectile.
And recent studies bear out just how dangerous this is. Dr. Nadine Levick of Johns Hopkins University is a physician and safety expert.
Now, you can crash a racing car at very high speed and walk away with nothing more than a broken fingernail. And then there are other vehicles, such as ambulances, where you can crash their vehicle at 20 miles per hour and have serious injuries.
Although cars have been crash tested extensively, few studies have been done on ambulances. Dr. Levick has organized the first comprehensive crash tests of an ambulance using dummies to find out exactly what happens to the occupants in a serious accident. One thing is clear, the back is the most dangerous part of the ambulance. Not only is there much work still to be done designing restraints, loose medical equipment flying around poses a substantial hazard.
We've seen injuries such as even a pelvic fracture from a flying defibrillator. And really, that should just not happen.
And those are exactly the dangers facing Calvin and Chris. While Gretchen navigates the notoriously treacherous streets of New Orleans,
Big Mom!
Hey, Dr. Wynn.
Chris radios ahead to the trauma team on his walkie-talkie.
He is apneic, pulseless, and unresponsive. He's asystole He's being ventilated with BVM 15 liters O2. How do you feel about a left side chest decompression?
Consulting with the trauma team, Chris knows that if he doesn't do something about the blocked lung, his patient will almost certainly die. The solution is decompression, piercing the chest with a hypodermic needle to release the blockage. The only problem is, any sharp object is doubly dangerous in a lurching ambulance.
Big bump, big bump.
Big bump, hold up.
Another one.
Hold on, y'all. Okay.
Hoping for a smooth stretch of road, Chris prepares to pierce the man's chest.
Go between the second and third rib. First rib, second rib, third rib. I have my landmark here. I'm going to go ahead and I'm going to place this needle in between the second and third rib.
He must be precise. A pothole or a sudden stop or a turn at this moment can cause serious injury to the patient or himself.
Glove here. 1, 2. All right, right over the top of the rib. Here we go. And it's in.
A trapped pocket of air escapes through the hole in the man's chest. If the patient has any chance of making it to the hospital alive, Chris just gave it to him.
Breath sounds are better, Gretchen. We're doing good.
Outstanding.
Chris and Gretchen arrive with their patient at New Orleans Charity Hospital, one of the foremost trauma centers in the world. The trauma staff is waiting for him.
He's shot to the chest.
We have given him two epinephrines down the tube, 1 epinephrine IV, 1 atropine IV. It's an 8.02.
We decompress too. Go.
Okay.
My toe. Somebody do compressions. Somebody do compressions, Chris.
He has one.
But the patient didn't make it. For all their work and the risks they took, he was declared dead on arrival. Speed and risk. Paramedics know they must be conquered. But one factor is inescapable. In a medical emergency, time is the enemy. The person behind the wheel of an ambulance will do everything in his power to fight against time. But on our roads and highways, speed can only play so large a part. When the distances are too great or the ground conditions too hazardous, speed belongs to the air.
That's 10-4, Air Mid 2, reassignment, turning around, about cardiac arrest.
Travel 60 miles to the southwest of New Orleans, and you're in a different world. This is Cajun country, a vast rural area of small towns, farms, fishing, and oil. Providing ambulance service here poses its own particular set of dangers.
There are literally thousands of miles of bayous, very intricate, very complex. Needless to say, you wouldn't want to venture out there unless you have first-hand knowledge of the area or if you have some very good mapping.
The Acadian Ambulance Company overcomes these problems by flying over them in Air Med, a fleet of 5 helicopters. Fully equipped to provide sophisticated care in the field, they are, for all purposes, flying ambulances. Pilot Mark Morgan has flown for Acadian for over a year.
Just by virtue of the nature of the machine, enabling you to go in a straight line, you're saving an enormous amount of time.
Paramedic Jason Alamon works both on the ground and in the air.
I really enjoy being in the helicopter because it creates a lot of new challenges. There's a lot of different equipment that we utilize, different patient challenges than what you deal with on the ground.
Probably the greatest danger Jason and Mark face is the weather. In southern Louisiana, it is volatile and unpredictable. Right now, Air Med isn't going anywhere. Mark has declared it grounded. If a call comes in now, no matter how serious or far away, an ambulance will have to get there by ground. But this storm disappears as quickly as it came, and just as suddenly, Air Med gets a call.
They want us for an emergency offshore. Copy.
A man has collapsed with chest pain. He is 60 miles away on an oil rig off the Gulf of Mexico. Air Med is the only solution.
The reason for that is this patient offshore, there's no other means for him to be transported. His only way out is by helicopter.
The weather isn't perfect, but Mark gives the go-ahead to take off.
Dispatch gives us as much information as possible. They give us the name of the rig, they give us the coordinates to the rig, and they give us the radio frequency that that rig is on.
If they don't meet a headwind, they can fly up to 120 miles an hour. Even at that rate, Jason and Mark are about half an hour away from their patient. In air rescue, there is an absolute division of responsibility. Jason never flies the helicopter, and Mark does not concern himself about the medical aspects of their calls while en route. In fact, Mark does not even listen to the same radio frequency Jason does when he gets medical information about the case. If he knew too much, he might be tempted to take unnecessary risks.
Something we talk about is white knightism. You hear about a 6-year-old child hit by a car, bleeding to death. You want to get there. You want to save that life. That's what we do. But in doing that, it takes our focus away on what's important. White knightism has killed a lot of people. It's caused people to fly into fog banks, fly into mountains, take off in equipment that shouldn't be flying at that specific time.
Mark keeps his attention on the safety of his aircraft. Besides the weather, he must never forget about the terrain he's flying over. In this part of the country, it changes rapidly, each area presenting its own hazards. As he leaves the residential section of Terrebonne Parish behind, Mark heads out deep into the bayou. Here, even what looks like solid ground is swamp.
This aircraft is equipped with inflatable floats on the landing gear. If in the event we should have some type of failure, then you just land in the water.
But even if they survive an emergency water landing, the local wildlife will be waiting for them, and some of it is very dangerous.
Roger, roger. We got a man on the heliport there watching you. We got a man on the heliport there looking out for you.
Finally, they arrive at the rig, just off the open ocean. The call couldn't have come from a more isolated area. Time is precious, but Mark isn't going to land the helicopter until he knows it's safe. He first does a high recon, circling the rig at about 1,000 feet.
After the high recon, I'll drop it down 300 to 500 feet. Take a closer look for wires, towers, other obstructions that I couldn't have seen from 700 to 1,000.
Mark decides that it is safe to land, and AirMed touches down.
Take a deep breath. In and out, just breathe.
Down below, Jason finds his patient. He is still suffering chest pain. One of his co-workers, trained in first aid, has already given him oxygen.
We started IV therapy, and we started giving him medications to treat his pain, his discomfort.
All right, lift up your tongue for me. Lift it up, not stick it out, lift it up. There you go. Okay. Listen, what I need you to do, I'm gonna give you some aspirin, okay? Baby aspirin, chew them and swallow them. That medicine I just put on your tongue is nitroglycerin. What I want you to do is tell me if the pain gets any better, all right?
Once we have a good handle on the stability of the patient, we load the patient into the aircraft.
Let's go head first. So we nothing drag, up high. Ray, hold that with your arm there, bud. All right, Ray, how you feeling?
With their patient secure, Mark and Jason prepare to take off.
Good there.
How much you weigh, Ray? Mark, you heard that? What do you got? 144. Roger.
Now, I am concerned about the weight of the patient because that's part of my cargo. The medic's going to take care of all of the rest of the stuff. He's going to tell me where we're going.
All right, Terrebonne General it is.
Terrebonne it is, okay.
At that point, it's strictly a problem of putting a flight plan together quickly and getting to that hospital as fast and safely as possible.
Ray, I'm gonna put some earmuffs on you, but we'll talk every now and then, all right? Just because it's so darn loud.
AirMed gets the patient off the rig. They're on their way. But there's still a lot between them and Terrebonne General Hospital. Another storm is heading in their direction.
Got a little weather over there, yeah. A lot of rain here, Mark. But we may get wet.
But Jason must leave all the problems of flying to Mark and attend to his patient. Not an easy thing to do in such a confined space.
You are limited to the amount of space you have in the aircraft, IV access sometimes, the angles you may position yourself at to treat the patient are a little bit different. Probably the biggest thing is the communication with the patient is a lot more difficult.
Jason is particularly relieved that this patient is calm and cooperative. A combative patient would be extremely dangerous in an aircraft.
That's one thing we are cautious about is we try not to take any patient that would be in a combative state. If the patient's jumping around and violently moving around, we're in very close proximity to one another. I may be at risk, for getting injured by the patient, and it gets pretty hairy.
They make good time. A wind comes up, but it's at their back. They outrace the storms and get to Terrebonne ahead of schedule. Their patient is now almost at the emergency room and the definitive care he needs. But Mark knows that the trickiest part of the flight is about to come.
Of course, if anything should go wrong and you would have to land somewhere other than the hospital heliport, you run the risk of hitting wires, houses, cars, and parking lots. And wind, that's a consideration, because when wind hits a flat surface, a wall, it tends to shoot up, right, down. It'll create turbulence over the helideck itself.
But once again, AirMed touches down without incident. Hospital staff meets Jason and helps him get the patient downstairs. His condition was not serious, and he was released shortly afterwards.
Well, I've enjoyed flying one thing or another for 26 years. In EMS, I feel like I'm making a little bit more of a difference from time to time. Instead of just operating a helicopter and earning a paycheck, here I get to earn a paycheck and at the same time save a life now and then. And that's important to me.
All right, come in.
But Acadian still does most of its work on the ground. A private ambulance company, it covers 21,000 square miles, serving 2.3 million people. But if they've been given the wrong information,
So just go up straight right here?
no amount of speed can help them when somebody's life is on the line. Not all the dangers to paramedics are physical. Stress plays a major role. In southern Louisiana, paramedics must often drive long distances to calls on back lanes and country roads. So they don't have to speed or risk getting lost, paramedics and dispatchers use the latest in communication technology.
She looks pretty bad. She's in her car.
The Acadian Ambulance Company has invested millions of dollars in high-tech equipment at its company headquarters in the city of Lafayette. The heart of Acadian's computerized operation is a global positioning system, or GPS, a satellite mapping program. It keeps track of the location of each and every ambulance in the fleet. Dispatchers now know which ambulance is closest to each call, and they have a computerized map to help with directions.
Having GPS, we're able to pinpoint locations with the click of a button and take the most expedient route by ground if need be.
For paramedics like Casey Thibodeau, the technology is a lifeline, an ally against the dangers and stress of paramedic work.
With the global positioning system and the tracking devices we have, they can pinpoint our location within 50 feet. So provided that the map book is accurate, they can guide us in just by tracking us from the dispatch center in Lafayette.
But the technology is not foolproof.
Acadian Ambulance Service, your emergency.
A private medical alarm company calls into Acadian.
You have a medical alarm at a residence. Okay, where at? Which city is that in?
Somebody has pushed an automatic alarm button in the city of Thibodaux.
Union Park Avenue, signal 32, medical alarm going off. Cross street is Ridgefield.
The call is dispatched to Casey and his partner Jeremy Dufresne. The alarm company gave dispatch an address and a cross street. This information is passed on to the crew.
We go on to Park Avenue. It's off of St. Mary.
Casey and Jeremy talk via intercom to determine the most direct route.
So just go up straight right here?
Yeah, keep going straight.
We're down the street now, so we should be coming up to it soon.
So we're gonna go ahead and bring in all our equipment.
As they pull up on scene, Jeremy looks for the exact address. But there's a problem. The address and cross street dispatch got from the private alarm company, and which was passed along to Casey and Jeremy, does not exist. They decide to try the closest address. They can only hope for the best. They ring the bell, but there is no answer. They have no way of knowing if their patient is unconscious or if they have the wrong house. Either way, precious minutes are passing for what might be a seriously ill patient.
You got your portable? See if he's got a callback number. We really don't have access into the house.
Bruce. Hello, did y'all call for an ambulance?
Oh, we sure did.
What's the address here? Okay, thanks. Sorry to bother you.
It isn't the right house. Casey and Jeremy consult with supervisor Bruce Boudreau, who has followed the ambulance in a truck.
I know there's an elderly lady.
Bruce checks in with headquarters.
House she lives in. Got an outside alarm.
Since they got the wrong address from the alarm company, they must improvise where to go next.
It's not in the map book.
They decide to drive down Park Avenue, their minds searching for options. Perhaps in transmitting the address, the alarm company forgot one of the digits. But Jeremy is not optimistic.
So right now we're kind of on a, not to say a wild goose chase, but similar to that where we're just kind of looking for our patient. This happens rarely. When it does, it can be a bad thing.
It's been almost 15 minutes since they first got the call. A seriously ill patient could already be dead.
When you have conflicts with the address or the street name, it causes delay, and it kind of gives you a feeling like your hands are tied because you know someone needs help, but you can't get there to help them.
They try other houses to look for their missing patient.
Which one? The white one?
Jeremy checks back with dispatch.
Casey.
This is the only park listed in the map book in Thibodaux.
Coming at you now, Brian.
Oh, how you doing? Y'all didn't call for an ambulance here by any chance, huh?
But it's another dead end.
Bruce.
Casey has worked in this area for years, and he is at a loss.
Unless he's talking about Park Avenue, which is the road across from the station, the main road, and wouldn't be anywhere near Ridgefield.
He believes that it's the street name and not the address number that is wrong.
It used to be West Park and West Main.
But it don't cross Ridgefield.
Right. But that's the only other Park Avenue there is.
Dispatch confirms Casey's suspicion. It seems the outside alarm company had the wrong street. Paramedics know firsthand that inaccurate information can cost lives. Hoping that it's a false alarm, Casey finally approaches what he thinks is the right house.
Call for an ambulance over here? Do y'all have one of those little buttons, a medical alarm? You got a security system?
Yes.
Okay. Is your security system going off right now?
If my little girl accidentally pressed the button and I pressed it.
We got it, Bruce. She accidentally pushed the button.
Yeah.
Okay, we're gonna be right back with you in a second. We got it, Bruce. This is it. A little girl accidentally pushed the button on the security alarm.
It wasn't an emergency. After more than 25 anxious minutes, Casey and Jeremy can finally breathe a little easier.
Everybody kind of lucked out on this one. You just got to use your instincts sometimes. Sometimes you're right, sometimes you're wrong. This is one of those cases to where, luckily, for everybody's sake, that it wasn't anything.
In the end, the call wasn't a waste. This mistake might someday save a life.
In a way, it's good that we did get lost because we have identified a problem with the mapping system, and we can be assured that this won't happen again.
For paramedics, getting to patients fast has always been the key. It's all part of their stressful and often dangerous job.
It's a field that not too many people, I guess you could say, can handle. You have to be good at your skills and be a strong person overall. You have to know that you will see things that not everybody will see on an everyday basis. And you have to be ready for that.
In New Orleans, Gretchen and Chris are nearly at the end of a grueling 12 hours in the field. Soon they'll be able to go home. But for the moment, they've got one more call, a woman in extreme abdominal pain. But there's a potential problem. The neighborhood they're heading towards is notoriously dangerous. An EMS supervisor precedes them in a van.
This is what we call Code 9. Means the supervisor's clearing the way for you.
But Gretchen has to be particularly careful when following another emergency vehicle, especially through an intersection.
I don't always like to be the second unit behind somebody because they think that just one ambulance or one sprint car or one police car is coming and they hear the noise and they stop for the first, but they don't stop for the second.
She going down there. I said,
okay, ma'am.
She's 20.
At the scene, the situation is volatile. The patient's family is upset, and several people are intoxicated.
Man, y'all talking about what's going on.
All right, that's enough, that's enough.
Okay. That's enough of that.
They must get their patient into the relative safety of the ambulance, or things may get out of hand.
Okay, you can't go to the hospital if you're going to talk like that.
You can go with him, but you can't go like that. You gotta get
But the safety is short-lived when the patient's mother tries to get in the ambulance.
No, ma'am, you're not riding.
You have to get out.
You need to get out. You were verbally abusive to us and you've been drinking. You can't ride to the hospital in the ambulance. She doesn't want her mom up there and she's drunk. We need to get her out.
Okay, yeah.
We ready?
Having dealt with the family, Gretchen and Chris can now get their patient to the hospital.
Confusion and screaming and what we call tachycardia is going on. We call tachycardia is when a bunch of people are screaming and yelling and calling the Lord, and that seems to go around here with the alcohol and the drugs and the abuse that goes on.
It's dangers and difficulties like these that paramedics across the country face every day. But the pay generally is low, averaging about $30,000 a year, depending on the location. Few jobs are as difficult or as stressful.
We don't go in on anything that is good. The only positive thing that I feel we really do in our profession is deliver babies. You know, other than that, we're going in somebody's worst nightmare.
And when things go wrong, the nightmare may also be the paramedics, facing the dangers of accidents, disease, and crime, and sometimes, when a life is lost, running afoul of the law themselves.
I thought I was out there making a difference. And now all of a sudden, it's gone.
But for all the dangers and stress, paramedics find many personal rewards.
You still do come across some people that you get there and they say, just put them in the ambulance and go, and they don't understand. But once they see you pull out the oxygen and the monitor and starting IVs and giving medications, they kind of realize, hey, these guys can do some things here. You know, they're not just ambulance drivers anymore. Ambulance driver has almost become an insult in the past few years.
I often say to people, you know, should it be that I'm in an ambulance as a result of some sort of injury, I'm not in such a big hurry to get to the hospital. I'm very, very confident in the care provided to me by the paramedics, and they can drive as slow as they like.
It's all for the love of your job, you know. If I didn't like doing what I do, I definitely would not be doing this for 14 hours every day. I believe there's dangers in every job that you do. This happens to be a very dangerous job. Not too many people see that. They don't understand it. We're facing dangers all the time simply by driving down the road. But on the other hand, even though the job is dangerous, it's a great feeling. It's a natural high to know when you saved a life. It gives you a really good feeling.
Up next, experts reveal their long-kept secrets of the art of illusion.